So this individual is a 57-year-old white male who came in yesterday. Basically, he just came in for refills. Um, as far as his history, he has a history of high blood pressure, and he also has a history of psoriasis. It's pretty severe. He's actually seeing a dermatologist, and he is seeing a dermatologist, and he is taking the Dupixent shots, injections. According to him, he was started on Remvoke, which is a different type of uh, injection for severe psoriasis, but he developed a lot of shortness of breath and dyspnea on exertion. So they changed him to the Dupixent, which he states is working fairly well. He feels like um, the outbreak on his skin is getting better since he started taking the injections. So he was there just to get a regular checkup. Also, he asked that we do blood work on him because his blood count has been uh, abnormal. Specifically, his white blood cell have been elevated. I think we all can determine why that is based on the medications that he's taken. So again, he has a history of high blood pressure. Um, as far as vital signs, blood pressure was 146 over 93. His pulse was 84. He had a temp of 98.1. Respirations were 20. He had a BMI 34.11. And the O2 saturation rate was 95% on room air. Um, Again, his main complaint was shortness of breath. Um, he also complained of insomnia, basically saying he only slept 3 to 4 hours during the night. Um, so, as far as blood medications, the only medicine he was on was again a Dupixent, and he was taking amlodipine 10 milligrams daily. So, with his blood pressure being at not controlled at 146 over 93, which he say is actually good for him, is actually higher than that, much higher than that. So what I decided to do was start him on another um, antihypertensive medication. When I did his assessment, of course he's obese. Um, his lungs had wheeze. He was wheezing in all as lobes of his lung. No dipsy or notice with exertion, but you can tell that he's deconditioned. Height versus weight, his BMI was just like 34. So I think he was 5 feet, if I'm not mistaken. So with his BMI being that high, you can imagine what his weight was based on his height. So I did his blood work. I drew some blood work, and I actually got the results back today. Okay. So complete blood count. White blood cell was 12.7. Red blood cell count was 4.07. Hemoglobin was 14.3. Hematocrit was 42.4. His MCV was 104, which is slightly it was elevated, and his MCH was 35. Platelets was 315. Absolute neutrophil was 9.3. Let's see. As far as his CMP, complete metabolic profile, BUN and creatinine was within normal range. His glucose was 93. His AST, ALT, his alkaline phosphatase, bilirubin, they were all within normal limits. Total cholesterol was 167, although his triglyceride was slightly elevated at 158. his HDL was low at 30 and his LDL was high at 109. Vitamin D level was 17.8. Thyroid function level, his TSH was 3.320 and his free T4 was, they didn't draw that. Normally I get a TSH, but with this company, they actually do TSH with reflex free T4. So they didn't, because the TSH is considered within normal range. I guess they didn't get the free T4. Vitamin B12 was 339 and folic acid was 2.2. PSA was 1.94. So just basically tell me, what medication do you think would be a good medicine to add on as far as with his blood pressure, considering all his other issues with the psoriasis and the type of medication that he was on. Also, what other than I gave him albuterol inhaler. He's a smoker, so I did give him a albuterol inhaler, which he has had in the past. But for some reason, he attributed his shortness of breath and issues with respiration to the medications that he has started on for his psoriasis. Even though he's a smoker, he's had albuterol and inhaler before. He's saying that his shortness of breath and wheezing didn't start until he was started on the Rinvoq. Um, with I attempted to tell him that it was likely due to his numerous years of smoking, and but he didn't want to hear that. So I gave him a albuterol inhaler. If we had to add on like a LABA or a SABA, additional SABA, what medication would you all recommend that I give him? I did a referral to pulmonology um, per his request. So again, please comment, like, give me some recommendations. Uh, give me some ideas about what my next step needs to be with him. And just let me know what do you if you think the my steps that I've done are not the correct steps, and what in addition I need to do. He has a follow up appointment in 3 months. If you would comment below and let me know what I need to do.